Anticonvulsants are super highly tested on in this course, no matter which school you go to. Because anticonvulsants have a lot of side effects, and we give them to a ton of people, not just seizure patients. We give it during surgery. We can give it for pain relief. We can give it, you okay? Damn, you look sleepy. We can give it for anxiety, okay? So you will see these a lot. They are highly testable for ATI, HESI, and in your classes. So that's why I want to go over these next.
Would you give it for seizure too?
Yeah, that's what they are, anticonvulsants, right? Because convulsions are seizures, right? But you can give them for a myriad of reasons, and that's why they're also highly testable, because you're going to give them to a bunch of different people. So how I did this is we're going to go through the side effects of all anticonvulsants as a whole. Then once we go to the next page, I'll just talk about things that are different or that you need to add for each drug. So each drug on here is going to include every single one of these plus whatever I wrote on here. Does that make sense? All right, so let's talk about anticonvulsants as a whole. What are seizures?
Oh, electrical impulse.
All right, so the electricity in the brain's going blah, 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 blah. So what do you think anticonvulsants do?
They
stop that. So all your anticonvulsants are going to be downers. They're CNS depressants, okay? So the biggest side effect that we will see is sedation and CNS depression. They're going to make you sleepy because they're downers. So for that reason, you would want to give it at HS. What's HS?
At night.
Hour of sleep. You're going to give it at night so that way they can have a good night's sleep and they're not tired all day. You are not allowed to drive unless you have been seizure-free for 6 months, okay? And until we know how these anticonvulsants are going to work on your body, okay? They are not supposed to go swimming alone, because what happens if you're on these drugs, you're very tired, you could slip underneath, okay? We will put them on fall precautions because it does cause CNS depression, right?
Yes.
When you are bathing or taking a shower, you have to let somebody know. We have had a lot of patients that have fallen in the shower, hit their head, get a hematoma, pass away. So you have to let somebody know, hey, I'm going to take a shower, check on me in 10 minutes. Mm-hmm. Do we understand?
Yes.
No alcohol with anticonvulsants, because alcohol is a depressant, and anticonvulsants are a depressant. All right, all anticonvulsants cause ataxia. What's ataxia?
Drunk walk.
Drunk walk. So altered gait, because they make you sleepy and they're CNS depressants. So we put them on fall precautions, and if they are going to get up and ambulate, they need to ambulate with assistance until we know how these drugs are going to work on their body. Now, a lot of people are on these lifelong and they take them every single day, but their body gets used to it. But at the beginning, we have to really help them along. Mm-hmm. All anticonvulsants are hepatotoxic. What'd I say?
All are hepatotoxic.
Okay, so you know what you need to do, right?
Yep.
All right. Almost every anticonvulsant is a P450, which means they interact with everything. So you have to watch all their other drugs. That's why I wanted to go over these, because you're going to see over and over again in your course. Interacts with anticonvulsant, interacts with phenytoin, interacts with phenobarbital. Of course it does, because they are all P450s, okay? Anticonvulsants, all of them are bad for pregnancy. Most of them are category C or D, but I want to be clear on this. If you have a pregnant mama who has seizures, we will have to keep her on these seizure meds, because if she's seizing during pregnancy, not only is it a risk for her to fall down, right, if she's having a seizure, but when you seize and you are pregnant, it is clamping down on that placenta and baby will not get oxygen. So we will continue them on the seizure meds, but most of the time, since it's C or D, it's not teratogenic, but a lot of times those babies will be born with defects like cleft lip and cleft palate or club feet. Okay. It does also make birth control ineffective because they're P450s. So we will always do a pregnancy test before we start a young woman on anticonvulsants. Okay, so we can choose one that is best for her. We will put all of our pregnant mamas on, or young women, I don't even care if you're pregnant or not, on folic acid, because a lot of anticonvulsants steal your folic acid. What'd I just say?
That they steal your folic acid.
Anticonvulsants steal your folic acid. What happens if a pregnant woman has a deficiency of folic acid?
They can't make the
neural tube defects like spina bifida. I think folic acid's on y'all's test, huh? Yeah. So we want to put her on folic acid supplementation. How much folic acid are pregnant women supposed to be on? And all women of childbearing age.
6,
8, I thought it was like 800.
400 milligrams. Okay. If they are pregnant, we will consider them high risk pregnancy because they are on category C or D medications. Use a backup method of birth control. I told you that, right? Vitamin K supplementation. So a lot of times they will steal, that anti-seizure meds will steal vitamin K from the baby, and babies already don't make vitamin K. You know, that's one of the injections they get when they're born.
Oh, I didn't know that.
When a baby's born, we give them eyes and thighs. That's what they'll tell you. Like if you ever go to the NICU or you go and you're working in the nursery, they say, hey, have you given your baby eyes and thighs? Because they put that cream in their eyes, that erythromycin ointment to make sure they don't get chlamydia, gonorrhea in their eyes. And they all get a vitamin K injection to make sure the baby can clot. Because where is vitamin K made and absorbed? It's made in the liver, absorbed in the gut. And when a baby is born, their gut is sterile. So they don't have what's needed to absorb vitamin K. So we give them a vitamin K injection. So we will start supplementing mama with vitamin K because we know that baby's going to be deficient. Okay. Why would we tell them to report amenorrhea?
No, that's.
What is
No
amenorrhea?
periods, right?
No period. If all of a sudden a woman of childbearing age is not having a period, she might be pregnant. Okay. All right. Next, all anticonvulsants have a narrow therapeutic index. What does that mean?
That it's it can either go toxic or ineffective.
You can go toxic very easily, and anytime a drug has a narrow therapeutic index, you have to draw levels. So all of your anticonvulsants today will have levels.
Okay.
Okay, yay. Okay. And you can get toxic because it has a narrow therapeutic index. What would happen if you got toxic on your anti-seizure drugs? What would that look like?
No good. You would be having seizures, right?
You would be like
Maybe
comatose.
CNS.
Yeah, you'd be like comatose or not wake up, right? Because these are sedatives. These are CNS depressants, right? All right, next thing, anticonvulsants. All of them cause blood dyscrasias. What are blood dyscrasias?
So crazy.
Crazy blood. And what do we usually see blood dyscrasias? What kind of drugs? Anytime there's a side effect of blood dyscrasias, what can you pretty much assume about that drug?
Affect the
It's
blood.
hepatotoxic. Remember?
Yes.
Okay, because your liver makes red blood cells, white blood cells, platelets. So if there is a drug in all of pharmacology that is hepatotoxic, most of the time you'll see blood dyscrasias as a side effect. Yeah?
Mm-hmm.
Okay. So in our patients on anticonvulsants, we have to watch their CBC. We will tell them to take folic acid because all the anticonvulsants steal folic acid. And then we correct any deficiencies depending on what they are. Okay. All of your anticonvulsants increase suicide risk. Safety first. So anytime you have a patient that's on long-term anticonvulsants, I'm going to ask them the questions. What are the questions?
Oh, do you feel like harming yourself?
Have you thought of harming yourself or harming others? Do you have a plan? You want to make sure you do a suicide screen. Okay.
Mm-hmm.
All right. All anticonvulsants can cause bleeding in the neonate if mom took it during pregnancy. I just told you all that, right?
Yeah.
So we do supplement with vitamin K for mama, and we'll give vitamin K to baby if mama was pregnant while on anticonvulsants. Do you understand the side effects of all of them?
You said mommy and baby, right?
Yeah.
Okay.
We understand?
Yes, ma'am.